how could I teach a model of therapy that was as effective as everything else? For me, this sent me back to the research literature. I really wanted to know, how could I get better at what I did? I had become a much more confident clinician, but the truth was I wasn't any more effective than I was as a student or prior to being at the Brief Family Therapy Center. When I looked at the research together with my colleagues about what works in therapy, here's what I discovered. About 50% of the people who start in treatment, regardless of the method and regardless of the problem that they present with, end therapy abruptly. That is, they discontinue without warning. Half of those who discontinue, in case you're wondering, have experienced no benefit from treatment whatsoever. That was a deep concern, and it wasn't just about my work or the work that we were doing at the Brief Family Therapy Center. It was true of all clients who entered treatment. Here's something else we know from the research literature that the team found when reviewing the evidence. Of those who do continue in therapy, a staggering 35 to 45% of those people experience no measurable benefit from the care, despite how long they may go in treatment. Now, I know that that may not add up to your personal experience, but I'm talking about the research, people who've carefully measured the results and followed clients over time. Here's another piece. It's surprising that the research indicates that our view of the therapy is often at odds with our clients. We may think we have a great relationship, but the clients simply disappear. And when we follow up and we ask them, in fact, one of the primary reasons they give is that the therapist just didn't get me. They didn't seem to understand what I wanted or were willing to work on what I wanted. Outside of all of those concerns, that is, the people who come and drop out, the people who come and don't drop out, they stay, but they don't experience any benefit. There's one very large and recurring problem in our field. Despite being on the scene for over 150 years, going all the way back to Freud, the truth is the majority of people who could benefit from our services, they never make it into a therapist's office. The figure, if you're willing to hear it, is between 80 and 85%. Take a moment and think about that. I know as a caring, thoughtful mental health professional, it will bug you as it does me. 80 to 85% of the people who have concerns that could be helped by seeing a therapist choose not to go. So the question is why? And this is a time to talk about it because it turns out that in looking at large demographic studies, fewer and fewer people are actually turning to psychotherapy to help with their problems. In fact, about 33% less than did 20 years ago. Now, I know what you might be thinking. You're thinking that, wait a minute, I have a waiting list, or my caseload is full, or the agency can't take any more clients. To me, that's a little bit like saying that there's no such thing as global warming because it's cold at your house. The truth is that when we step back and we look at large national samples, fewer people are turning to psychotherapy to solve their problems. Now, that's not necessarily a bad thing. People are doing other things. They're joining gyms, they are seeking out support from their friends, they're going to church, etc. But we are uniquely trained to help people with those problems, and it's sad that for some reason they don't end up in our offices. Well, at the same time, one of the other things people are doing is turning to medication. Curiously, when you ask people, would they rather talk to somebody about their problems or take a pill? And when I'm teaching about this in workshops, I often ask people to vote. What do they think? Would people rather take a pill or would they rather talk about it? And therapists, that is, talk professionals, say that they think people would rather take a pill. They're surprised when I say it's the reverse. Most people, upwards of 75%, would rather talk about their problems than take a pill. I know, I'm painting kind of a bleak picture of psychotherapy, and you may want to just go back in your office, shut your door, and meet with your clients. But despite all of these difficulties and troubles, I'm hopeful because I think the research literature is clear. Therapy works, and when it works amazingly well. Let me give you one other factoid. Psychological treatment of any kind that's been tested in a randomized clinical trial with any particular diagnosis or presenting concern of a client is as effective, has the same effect size as coronary artery bypass surgery. And I sometimes say in my workshops, the cool part is therapists leave fewer scars, and they hardly kill anybody they work with. What we offer is really helpful to people. The question is, how can we improve our work? Let me give you one more in case you weren't impressed by the coronary artery bypass surgery. When you go to the supermarket and you're in the market for buying some toothpaste, there are myriad choices. You can buy a toothpaste that's flavored spearmint or bubblegum. You can get it with stripes or sparkles. You can pump it or you can squeeze it from the bottom of a tube. Despite all those differences, there's actually only one effective ingredient in toothpaste, and that's fluoride. So the question is, how big of an effect does fluoride have in preventing dental caries? Well, I'll tell you, psychotherapy's effect size is 4 times greater than fluoride in the prevention of dental caries. We should put therapists in a tube. Maybe then we'd have people using it more than they do at the present time. So the question really is, how can we improve our outcomes? How can we get more people into care? And about 20 years ago, my colleagues and I were struggling with these questions. We knew that the particular brand of therapy that a therapist used really didn't predict how effective they were. Neither did their licensure or their background or training. Attending conferences, earning your CEUs, none of these things seem to be predictive of outcome. Neither is therapist experience. I know that's hard to believe, but that's essentially what the data have said for the last 30 years. Being an experienced therapist confers no advantage in terms of outcomes. So our colleagues struggled with this because personally, that's what I wanted. I wanted to be a more effective practitioner. How could I do that if going to workshops, if getting training, if getting supervision, none of that stuff seemed to make a big impact on my outcomes?